and welcome to everything you need to know about your ABA insurance benefits and eligibility. I'm your guest speaker, Laura Schueller with Above and Beyond Learning Group, also referred to by our acronym ABLG. This webinar is brought to you by our friends at Autism Family Services of New Jersey, a part of the Family Resource Network. I'll do my best to provide you with a clear understanding on the topic of ABA insurance benefits and eligibility. There will be a question and answer segment at the end. We ask that you reserve the questions for that time and make sure those questions are questions which would be helpful to other attendees as well. Once again, if you have questions specifically related to your coverage for your child, I ask that you contact me offline and I'll be happy to answer your questions one-to-one. For those of you who are not familiar with ABLG, our services, and what makes us an authority on ABA insurance benefits and eligibility, allow me to share some information about us. Above and Beyond Learning Group is one of the largest privately owned agencies in the state, specializing in applied behavioral analysis, also referred to as ABA. We've been providing home-based ABA therapies for over 10 years. Established in 2003, it's our experience and knowledge in the field of autism which makes us one of the leading ABA providers in the state. ABLG has been recognized by Governor Chris Christie as one of New Jersey's top professionals in the field of autism. In addition, Above and Beyond Learning Group is state approved by the New Jersey Department of Education. You're probably asking yourself, what does that mean? Well, school districts are required to use only approved providers to purchase anything from pencils to books to furniture, and yes, even special services. So as a state-approved provider, it simply means that schools operated by the New Jersey Department of Education are able to use state and government funds to pay for our services. So let's begin with some commonly used terminology. What is ABA? ABA stands for Applied Behavior Analysis. ABA is the application of operant and classical conditioning that modifies human behaviors, especially as part of a learning or treatment process. In the simplest of terms, it's being able to break down big lessons into small steps in order for the learner to be able to acquire skills. For example, some children may be able to learn how to wash their hands by watching someone else do it. Other children may need to be taught each step, from approaching the sink to turning on the water to drying their hands. By using teaching methods which are individualized for each learner, we're able to determine how to most efficiently and least intrusively teach skills through the use of data collection. The instructor can pinpoint where the learner is experiencing difficulty, thus allowing the instructor to modify or repeat the lesson so that the learner can develop the skills in the area which present the most difficulty. By mastering the small steps, the learner can make progress toward learning larger skill sets. What is EI? EI stands for Early Intervention. Early Intervention is a state program available to help infants and toddlers who have developmental delays or are at risk for such delays. Early Intervention is for children from birth up to age 3. The program serves children with diagnosed disabilities and children at risk for developmental delays for other reasons. Early intervention is available in the state of New Jersey for children ages 0 to 3, but EI is not free in the state of New Jersey. Early intervention, there is a fee for it. The cost of services is based on your household income. This is more commonly referred to as family cost share. What is DI? Well, DI stands for Developmental Intervention. Developmental therapy is commonly referred to as special instruction. Early intervention developmental therapists serve families in many different ways that contribute to the cognitive and social development of a child. The developmental therapist aids the families in the design of environments and activities that promote the child's general development, participates in curriculum planning aimed at meeting the goals laid out in the child's individualized family service plan, otherwise referred to as the IFSP. They provide families with information, skills, and support related to enhancing the skills development of the child, and they work with the family and the child to enhance the child's development. Developmental therapists they also help families incorporate different goals on which the child is working on into the family's daily routines, while identifying and guiding the family through the next steps of supporting the child's development. What is VB? VB stands for verbal behavior. You may have heard the term verbal behavior and are wondering if VB is the same as speech. The answer is no. Verbal behavior therapy teaches communication using the principles of applied behavioral analysis. VB therapy motivates students to learn language by connecting words with their purpose. The student learns words that can help obtain desired objects or other results. Simply put, VB is one of the many techniques of ABA which can be used to help your child learn. Now that we're clear on some of the more commonly used terminology related to autism, I can begin to address some of the more common questions related to insurance coverage of ABA services and address some of the misconceptions about ABA insurance benefits and eligibility. The first thing you should know is that ABA is covered by insurance for children and young adults age 0 to 21. The child must have a diagnosis of autism. PDD-NOS and Asperger's syndrome are both considered to be on the autism spectrum. Autism must be diagnosed by a medical doctor. More commonly, this diagnosis is usually made by a developmental pediatrician or a neurologist. A psychologist or school personnel cannot make an autism diagnosis. You will be required to present proof of medical diagnosis before your child is authorized by your insurance company to receive ABA therapy. If your child has not been diagnosed on the autism spectrum, insurance will not cover ABA. This does not necessarily mean that ABA would not be an effective therapy for your child. It simply means that the insurance would not cover the therapy. Most ABA providers would be happy to work with you privately, meaning they will be able to offer you services which you could pay for at your expense. The second thing you need to know is that ABA for the treatment of autism falls under behavioral health services. It is not considered a medical treatment and therefore cannot be billed through insurance as anything other than ABA for the treatment of autism, which falls under behavioral health services. If your plan does not cover ABA, there is no way around it. The services would simply be excluded from the plan. The following types of plans will cover ABA therapy if the benefit is available. Medicare plans are state-funded plans, which makes them self-funded. In my experience, I've yet to come across a Medicare plan which includes the ABA benefit, but of course we always ask that you talk to your provider and find out if they can verify if the benefit is available to you. What does fully funded or fully insured mean? A fully insured plan means the employer contracted with an insurance company to cover the employees and dependents. Fully insured plans are more common to most. Fully insured plans are required to follow any state mandates. In 2009, the state of New Jersey mandated that any child with a fully insured health plan who is age 0 to 21 years of age is eligible to receive ABA for the treatment of autism through insurance benefits. What does self-funded or self-insured mean? A self-funded plan means that the employer assumes the direct risk for the payment of the claims for benefits. If an employer chooses to offer a self-funded plan, the employer may pick and choose which benefits they want to add on to the plan, which means they have the option to add ABA coverage. However, the employer is not required to comply with the state mandates. A self-funded policy supersedes any mandate set forth by the state. Is ABA therapy paid for by my medical insurance? ABA benefits are managed by the behavioral health management company of your insurance provider. For example, if you have United Healthcare or Oxford, your behavioral health benefits are managed by United Behavioral Health, also referred to as UBH. If you have Blue Cross Blue Shield of New Jersey, It is currently Magellan. However, as of July 1st, the behavioral health management company for Blue Cross Blue Shield of New Jersey will be Value Options. If you have AmeriHealth, your behavioral health benefits are managed by Magellan and may possibly remain Magellan. If you have Aetna, it's Aetna, they manage their own, and if you have Cigna, you also still have Cigna, they manage their own. Please be sure to check with your insurance provider to find out who the behavioral health management company is. In this section, we will be discussing the steps needed in order to verify your insurance benefits. Who do I call? You'll need to call the number on the back of your insurance card, which reads Member Services. I have reached a customer service representative. What now? Let the customer service representative know that you're calling because you have a child with autism and you'd like to know if ABA for the treatment of autism is a covered benefit. The customer service representative has said that they must transfer my call to a representative from the behavioral health division who can assist me. Is this normal? Yes. The number on the back of your card will connect you with a customer service representative for medical services. As I mentioned earlier, ABA for the treatment of autism falls under behavioral health services. The representative will most likely transfer you to a care advocate who can better assist you with the questions specific to benefit coverage for ABA for the treatment of autism. I have a care advocate on the phone who is able to answer questions pertaining to ABA. What should I ask? The first thing you need to do is inform the individual with whom you're speaking to that you have a child who's been diagnosed with autism and that you're trying to find out if ABA for the treatment of autism is a covered benefit. As they research your plan for information about whether or not ABA is a covered benefit, here is what else you should be prepared to ask. What is the effective date of my plan? That means, when did your insurance plan go into effect? For those of you who do not know when your insurance plan renews, it will automatically renew 1 year from the effective date of your policy. What state is my plan written in? You may be thinking, I live in New Jersey. Why does it matter what state my plan is written in? Well, insurance benefit allowance is based on the state in which your plan was written. There are many different reasons why an employer would choose to write a plan in a state other than the one which you work in. You must also consider that many employees may commute from another state to do their job. For this reason, it's possible that your insurance plan may be written in another state from which you live. More on that subject coming up shortly. Is my plan fully insured, otherwise referred to as fully funded? If your plan is fully insured, the ABA benefit should be available. If it's not fully insured, you will be informed that your plan is self-funded. If your plan is in fact self-funded, ask the representative if ABA is an additional benefit to the plan or if ABA is excluded. If the ABA benefit is not covered, your journey ends here. Please continue with this webinar and we will help you navigate through other options for ABA services. What will it cost? You will want to ask the representative for your patient responsibilities. Do I have a deductible? What is my coinsurance or copay? Do I have a maximum out-of-pocket? I have confirmed that I have the ABA benefit and am eligible to receive services. What now? Ask the representative if they can help provide you with a list of in-network providers. This is something they may be able to email or fax to you, or you may be able to go online to retrieve this information. Always ask for a reference number. A reference number will allow you an easier fast track to getting the answers specific to this conversation the next time you call. I can't even tell you how many times I've been misquoted information by a representative. A reference number can help verify the information which you were quoted if it was documented correctly during this call. This is key information when calling in the future regarding an autism insurance claim. We suggest that you ask for a number of someone you can talk to in case you have any additional questions. The representative may be able to assign you what is referred to as a care advocate, or more specifically, and preferred, an autism care advocate. Now that you've obtained the information regarding benefits and eligibility, I will now share information regarding receiving ABA therapy. Is there a limit to how many hours a child can receive? Maybe yes. The answer to this question will depend on what the autism mandate says for the state in which your insurance plan was written. If your insurance plan was written in the state of New Jersey and is fully insured, then the benefit is unlimited. However, ABA benefits require pre-authorization. Your ABA provider will need to submit a treatment plan along with goals and objectives which outline what skills they would be working on with your child and the requested number of hours, which will indicate the total number of hours which your provider is requesting to be authorized. Please note that an authorization for ABA services is valid for no longer than 6 months and will require a reassessment before the end of the authorization if you wish your services to continue. If your plan is written in the state of New York, you may be subject to a max benefit of 680 hours per calendar year. This max benefit includes any services that fall under the umbrella of ABA for the treatment of autism, which also includes an ABA assessment by a BCaBA, all the ABA therapies, program development, program maintenance, supervision, and the reassessment, which is required by insurance every 6 months. Who would be the person coming into my home to work with my child? In most cases, an ABA therapist, also referred to as a paraprofessional, would be the individual who comes into your home to work one-to-one with your child. Depending on the number of hours you're looking to have your child receive, you may be inclined to use more than one ABA therapist. A program funded through insurance will require that a BCaBA lead the program. What is a BCaBA? BCaBA stands for Board Certified Behavior Analyst. A BCaBA is a national certification issued by the Behavior Analyst Certification Board, also known as the BACB. Currently, a BCaBA is the only certification which is recognized by the insurance companies as an individual who is approved to lead a home program. What is a BCaBA? A BCaBA stands for Board Certified Assistant Behavior Analyst. The BCaBA certification requires an undergraduate degree and several related courses to behavioral analysis. Some insurance companies will authorize a BCaBA to lead a program under the direction of a BCaBA. I didn't mention this in the last slide, but a BCaBA has a master's degree always, and a BCaBA usually they receive it when they get their undergrad. What is a paraprofessional? A paraprofessional is an instructor who does not hold a BCaBA. Basically, a paraprofessional is your ABA instructor. In some states, a certification in ABA is required. In New Jersey, an ABA certification is not required. How do I choose a provider? Your insurance company can provide you with a list of in-network providers, or if your insurance company permits, you may opt to use an out-of-network provider, which has been referred to you by perhaps a doctor, family member, or friend. Please know that if you choose an out-of-network provider, that provider is still required to obtain an authorization for ABA services prior to beginning. Is there a geographical radius for a provider? Yes. The insurance company may share a list which contains providers who do not appear to be in your area or are simply too far. If you're unable to locate a provider in your area who has the availability to work with your child, you may be able to use an out-of-network provider of your choice if that provider is able to secure a letter of agreement with the insurance company. You have secured a provider. Can you get started? You're close. As I stated earlier, ABA therapy requires pre-authorization. Before services can begin, your provider will be required to collect some information from you, which includes a medical report written by a medical doctor. The medical report must state a diagnosis of autism spectrum disorder. This medical report should also have a recommendation for ABA therapy. If your medical report does not include a recommendation for ABA therapy, your provider will ask you to obtain a prescription or a letter from your primary care physician or prescribing physician for ABA therapy for the treatment of autism. Neither the report nor the prescription will need to specify a recommended number of hours. That will be determined between you and your BCaBA. My provider wants to do an assessment. Yes, before ABA services are able to begin, your insurance company will grant your provider an authorization to do an assessment, otherwise called an intake. A BCaBA will come to your home to meet with you and your child to observe his or her skills and learn more about the child. The home visit will allow the representative from your chosen provider's office to collect the information needed in order to develop a treatment plan as well as goals and objectives. This report, along with goals and objectives, will define the amount of services which you and your provider are requesting. Please allow your provider time to draft required reports and submit to your insurance company. Once this information is received by your insurance company, it will be reviewed and assigned to an autism care manager. Upon review, your provider will be notified of the number of units which they are approved to provide. My provider has received an authorization for ABA services. Once your provider has obtained the authorization for ABA services, they are approved to begin. Please be sure to contact your provider if you have received a letter of notification in the mail but have not been in contact regarding starting. Why is there an expiration date on my letter of authorization? Most insurance companies will issue authorizations for ABA for a period of 6 months. At the end of the 6 months, your provider will be required to perform another assessment which will require a revised treatment plan and current goals and objectives. Obtaining an authorization to continue should not interrupt the services in which your child is currently receiving. In this section, we will review some things that I have not yet addressed. Can I use more than one provider at the same time? No. In most cases, the insurance company will only allow you to use one provider. You must choose before an authorization can be given. We want to increase the number of therapy hours our child is receiving. Talk to your provider about increasing the number of hours your child is receiving. The BCaBA will want to determine if the number of hours you are requesting is appropriate for that child and if the provider has the time available to increase the number of hours which you're requesting. If agreed upon, the provider will need to make a request to the insurance company to increase the authorized number of units previously approved. I want to change providers. In order to change providers, both you and the approved provider should notify your insurance company that you've decided to discontinue services or that you've decided not to move forward. When speaking to your autism care manager, please let him or her know that you wish to change providers. Please know that you will be required to begin the process once again. I am changing providers, but I already have a home program in place. Is the assessment still required? In most cases, your insurance company will allow your provider the option of working off the previously approved treatment plan along with the goals and objectives, or authorizing a home visit which will allow the new provider a chance to meet the child and develop a treatment plan and goals and objectives which your newest provider feels is appropriate. If you're changing providers, most likely there's a reason why. It's usually best to allow the new provider the opportunity for a fresh start. In this final segment, I will talk about financials, touching briefly on information regarding billing and claims. Since billing codes, definition of codes, the length of time associated with the codes varies from insurance company to insurance company, I'll speak generally about what you should know. Does my provider pay for program materials? Program materials are not included in most home programs. the member would be responsible for paying for any materials which are needed. This would include minor expenses such as paper, pens, printing, photocopying, to games, and instructional materials. Please check with your provider for more information on required program materials and expenses. So how much will ABA cost me? If you have the ABA benefit and are approved to receive services, you will be held responsible for your patient responsibility. Going back to when you verified your coverage, you should know, do I have a deductible? Do I have a copay or do I have a coinsurance? Do I have a maximum out-of-pocket? If your plan is in your child's name and no other family members are covered in your plan, then you will most likely be responsible for the individual deductible if you have a deductible. Additionally, you would be responsible for either one copayment for each day that service is provided, or you would be responsible for the coinsurance for which a percentage of which the bill of service, this bill of service, I apologize. If going out of network, an individual maximum out-of-pocket may apply. Reasonable and customary expenses there's a limit for reasonable and customary expenses, so you may be responsible for additional fees. If your plan covers spouse and child or family, then you will most likely be responsible for the family deductible if you have a deductible. Additionally, you'll be responsible for either one copayment for each day that service is provided, or you'll be responsible for the member coinsurance, which is a percentage of the billed service plus any additional fees. If you're going out of network, a family maximum out-of-pocket limit may apply to reasonable and customary expenses. Additional fees may apply. What are the additional fees? If your provider is in-network, then they've already determined contracted rates with your insurance company. Services will be billed at these rates and your patient responsibility will be based on your coverage. Additional fees should not apply. But we suggest that you ask your provider about any additional fees. If your provider is out of network, you may be subject to additional fees. What I mean is that your insurance company has predetermined reasonable and customary rates for each medical billing code by unit of measure. If you have a coinsurance in which your insurance company will pay or reimburse at a percentage of the reasonable and customary rate, you will be responsible for your percentage plus any difference owed. And in this slide, I show an example, which I will walk you through. So this is a mock-up of insurance benefits. You can see that the insurance carrier is Blue Cross Blue Shield, and this is a card for John Smith. It gives a member ID number and its group ID. You can see that the out-of-network deductible is $1,000 for an individual or $2,000 for family plan. Insurance will pay 80% of reasonable and customary fees, and the member is responsible for 20%. His maximum out-of-pocket applicable toward reasonable and customary fees is $2,500. If he has a family plan, then it would be $5,000. So this slide represents the benefits for John Smith. The coinsurance covers reimbursement at 80%, and he's responsible for 20%. The reasonable and customary rate for the service that we're talking about, not ABA, just generalizing, is, let's say, $100. However, he's using an out-of-network provider who charges $125 for the approved service. The member would therefore be responsible for 20% of $100, which is $20, plus the difference in cost, which is $25. So it's that $125 minus $100 was the difference. Therefore, making the member responsible for $45. In this example, the member would be responsible for 20% of reasonable and customary charges until they've paid out $5,000, which is the family max out-of-pocket, at which point the insurance company would pay 100% of reasonable and customary charges. Yet the member would continue to be responsible for the charges which are greater than the reasonable and customary allowed amount. So the maximum out-of-pocket expenses will only apply to reasonable and customary rates. Do I have to submit the claims to my insurance company, or does my provider do it for me? If you're in-network, your provider will submit the claims on your behalf. If you're choosing an out-of-network provider, the answer to that question will depend on how that out-of-network provider chooses to do business. Out-of-network providers are not required to submit claims on your behalf. It is perhaps a client service that he or she may offer. But know that you may be required to pay for the full invoiced amount of the service, and it would be your responsibility to seek reimbursement from the insurance company. My insurance company is denying my claims. Insurance billing and claims reimbursement is not an easy job, but there are professionals out there who can help. Medical billing services like ACE are available to help alleviate some of the frustration and financial hardship brought on by the out-of-pocket expense of a home program. If you are in need of assistance gaining reimbursement, or you simply do not want to take on the responsibility of seeking insurance reimbursement, we suggest that you contact ACE for more information about how they can assist you with your billing, insurance billing and reimbursement. ACE is owned by the founders of Above and Beyond Learning Group, and they have a 100% success rate in getting claims reimbursed. For those of you joining us today who are ABA providers and are having difficulty getting reimbursement for the services which you've already provided to your clients, we invite you to call ACE as well. I would like to extend a very special thank you to our host, Lauren McAllister of Autism Family Services in New Jersey. Thank you so much for hosting this webinar and allowing ABLG to be a part of this series. I will now open the floor up to questions and answers.
Thank you, Laura, for presenting for us. We have a couple questions that came through. One being, what if PDD-NOS is a secondary diagnosis, not the primary diagnosis? Does the requirement to cover for a diagnosis of autism still hold?
PDD-NOS is considered on the autism spectrum and therefore is a covered service. Does not matter what the primary, if there's a primary, secondary, a diagnosis is a diagnosis, period, end of story. So yes, they would be covered if they have the benefit, if their plan is fully funded.
Okay, great. We have another question that asks, my plan has ABA coverage. It's written in Washington State. However, they're saying that the HIPAA laws state that at 13 years old, an individual has privacy rights. The son is 15 years old, and therefore the insurance company will not speak with the parents without his permission. So she's curious if you have any information on whether or not that is correct, if that's something that that is possible.
Oh, I'm not well versed on what the laws are in the state of Washington. I would ask that member to contact me offline. You can go ahead and you can email all the phone calls, all the voicemail messages, all the emails for Above and Beyond Learning Group come to my attention. So I ask that you either call me or email therapy@ablg.org. I'd be happy to get in touch with you, speak to you about it, and possibly reach out to your insurance company to dig through. I think you're getting some bad information, and I can't be certain, but let's look into it further.
Okay. Laura, can you say again who the behavioral health services group is for Aetna?
Aetna. Aetna has their own behavioral health management subdivision of their company. So when you call Aetna, they have like an unpublished group of care managers, so you never know, like you don't have a specific person. Like those of you who are listening, if you're like receiving services, you probably know who your care manager is, or like for example, for Blue Cross Blue Shield of New Jersey, like you're always going to get the same two people because they pretty much run the entire department in that company. However, with Aetna, you sort of don't know who you're going to get. You get thrown into a pool and then you get a number, and it's when it renews, it may not be the same care manager, but it might.
Mm-hmm. regarding deductibles, if we have a $75 deductible, do we have to pay $75 for each therapy session?
Okay, in that question, I'm going to assume that she means copay, or he means copay, because your deductible for insurance, I've never seen a lower deductible than $100, but your deductible is the amount that you have to pay out before your insurance company will begin to pay. Some people do not have a deductible, they simply have a copay. So if your copay is $75, then you would be responsible for paying $75 on each day that service is provided. So regardless of how many hours your child is receiving in a day or how many people come to do the therapy from that provider's office, you would only be responsible for one copay. So I don't know, if you're someone who gets, let's say you get services in the morning and then a therapist comes back in the afternoon, could be a different therapist, but whatever, from the same provider's office, and gives another 2 hours of therapy in the afternoon. Your child is getting 4 hours of therapy. You're only responsible for paying one copay for that day. You don't pay for a copay every time someone comes to your home if they come multiple times in a day. Is that clear? Does that make sense?
Gotcha. So if you have a team of 3 therapists that come throughout the day, you'd only pay one $75 copay.
Correct.
For those 3.
Correct. But if you have coinsurance, then of course you pay a percentage of the billed amount, and for some codes it's 15-minute units, for some codes it's 1-hour units, so it varies, but you would be responsible for your coinsurance.
Okay. Let's see. If my child was diagnosed with Asperger's at age 5 and is now 16, would the report from the diagnostician still be valid?
The diagnosis hasn't changed, so the report would still be valid. However, more than likely your insurance company is going to ask you to have proof of current diagnosis stated. So I would say go to your primary care physician and get a letter stating that your child has Asperger's syndrome and that they're recommending ABA therapy.
Okay.
And they don't need to specify how many hours that when you have a child that's just diagnosed, normally in the medical report, the doctor will put a recommended number of hours, which is great, but that's really for the parent. That's not really for the provider. The number of hours that your provider is going to receive will definitely take that into consideration, but it really is based on what can you afford, what does the schedule allow, and how many hours do you think is appropriate for that learner.
Okay. My plan is self-funded with ABA clearly not covered. Are there any options to get some other kind of insurance for the child to cover services?
Okay, so if your plan is self-funded and ABA is an excluded benefit, then you're not going to be able to get ABA services covered through that insurance plan. If you are married, I would say see if you can pick up a secondary insurance if your spouse is employed. You may be denied through your primary policy, but you can definitely you can use secondary insurance if the coverage is available. So that's option number 1. Option number 2 would be talk to your school district and let them know that you feel that your child needs ABA therapy in order to carry over what he's learning from home to school and from school to home, and that you're having difficulty. See if you can if they'll allow to pay for services. In some cases, they will. If they will not pay for services, you can purchase a insurance plan independently, but make sure that before you purchase the plan that it's not self-funded. Please make sure that you purchase a fully funded plan. And if you're purchasing a plan that's being written out of state, make sure that you're aware that limits may apply. And then the last option that you have I don't know if it's going to be helpful, but the parents can receive therapy through mental health benefits, or even the child can, it's not really going to, the child can receive a different type of therapy. Like they can see like a psychologist or a licensed professional counselor. It's not ABA, it's someone for them to talk to. If that's not what you're looking for, it might be effective for the parent in order to gain some coping skills and things that maybe they weren't aware of, and techniques. If you're fortunate enough, you can find somebody who is duly licensed. Like if that were me, if I were in that situation, I would be looking for either an LCSW, which is a licensed clinical social worker, or an LPC, which is a licensed professional counselor, who has who also holds a BCaBA, so a duly certified person. There's not a whole lot of them out there, but they are out there, and I would recommend going to psychologytoday.com. It's an excellent resource for finding mental health providers, and it actually gives you like a sort. You can actually put in autism and scroll through the people that in your area that are able to treat and see, you know, what services they have to offer.
Okay. So just to clarify, in order for ABA services, a report with the diagnosis from the physician and a recommendation from the physician for ABA for the treatment of autism would both be required for insurance coverage?
Yes, the medical report that initially states the diagnosis normally says at the end, it's like the last paragraph or the second to last paragraph, it'll say something like they meet the criteria for autism spectrum disorder and make a recommendation for ABA therapy. If it does not make the recommendation for ABA therapy, your insurance provider is going to ask you to either obtain a prescription or a letter from your primary care physician, or you can go back to the neurologist or developmental pediatrician who you saw, whoever you want to see, but you have to see a medical doctor and get either a letter or prescription for ABA therapy for autism, and it should have the diagnosis code on the script for autism, which is 299.00. That is the DSMB medical billing code for autism. Just to touch a little bit further on that, it used to be like there used to be like 0.80 with Asperger's, and then there was a point something else for PDD-NOS. And when the DSMB changed recently, everything on the autism spectrum now falls under 299.00. So that's why I had said earlier that if your child has PDD-NOS, which is pervasive developmental delay not otherwise specified, or Asperger's, it still falls on the spectrum and therefore is still covered.
Okay. We have Blue Cross Blue Shield of Rhode Island, although we live in New Jersey. Blue Cross Blue Shield Rhode Island will cover autism therapies, but my husband's company has a rider stating that they do not cover any autism therapies. Is there any way that I can get coverage?
I would ask that that person contact me offline, because the facts don't seem to add up to me. It sounds to me like the state mandate allows for ABA therapy, but you're saying that the plan excludes it, which probably means that the plan is self-funded and doesn't have the benefit, and therefore is there a way around it? If that in fact is the question, the answer is if your plan is self-funded and doesn't include it, it does not include it. However, that question indicates that the insurance plan does and that the employer doesn't. I would want to look at that. I would like to look into that. If the attendee wants to contact me offline, please feel free. I'd be happy to look into it for you.
Okay. Laura, can you share any insight into the procedure for those who have Medicaid and would like to receive ABA?
Okay, so basically Medicaid is a state-issued plan, and so most of the state-funded, most of the state-funded plans are self-insured. And so in my experience, I've been doing this for about, I've been here for about 5 years, and yeah, the insurance, it passed in 2009, so I've pretty much been doing it for 5 years. In my experience, I have yet to meet a person with Medicare that actually had the ABA benefit. And the reason for it is it's quite honestly money. The reimbursement rate for Medicare is extremely low, and so most providers don't even want to go into network for the services. But I'm sure there are some out there that will. I just have yet to meet anyone who actually has had the benefit through Medicare, because they always come up self-funded and excluded. So once again, if you want me to, I'd be more than happy to look into it for you and see if that benefit is available. However, follow the instructions that I gave during this webinar, which is going to be posted to the Autism Family Services of New Jersey website, so you can go back to the slides that I was talking about. Call the number on the back of the card. Speak to a customer service representative. It is possible that you have the benefit available and they can give you a list of providers, but that would probably be my recommendation of how to go.
Okay. Is there a site anywhere that has a list of agencies that accept insurance for ABA?
No, but each insurance provider has a list of like a provider list available. So if you have I don't know, if you have Blue Cross, if you have United Healthcare, you can call it, which is a national plan, right? So now Aetna and Cigna, I believe, are national plans. United Healthcare and Oxford are national plans, and then Blue Cross Blue Shield varies state by state. So you have Blue Cross Blue Shield of New Jersey, of New York, of Rhode Island, of Illinois, whatever. So it varies. So I would say contact your insurance provider. If you have United Healthcare, contact United Behavioral Health and ask them for a list of in-network providers for ABA therapy, ABA for the treatment of autism. And they'll provide you with either a link to their website, if it's posted, or they will just send you a list or fax you a list. And same goes for like any insurance company. But otherwise you just have to call an insurance provider and say, hi, I want to use your services. Do you accept insurance?
Okay. I think I'm going to put out a last call. If anyone has any other questions, please type them into the questions panel on your control bar. But otherwise, it looks like that is all the questions that we have. Yep, I don't see any popping up. So I'd like to thank you, Laura, for presenting for us.
Thank you so much for having me. I appreciate the opportunity to speak to all of your listeners, and I hope that I hope this has been informative, and that I've answered some questions, or at least have raised some questions about, you know, what's going on with your home program, or what you'll need in order to start a home program. And once again, you know, feel free to contact our office. You don't have to use our services. I'm more than happy to help you. However, you know, Above and Beyond Learning Group does service the entire state of New Jersey and are starting to go outside the borders of New Jersey. So feel free to reach out to us about ABA services.
Super. And you guys can reach out to Laura at the email address or the phone number that's right on your screen at this moment. And as Laura stated, this entire webinar will be has been recorded and will be posted on our website, which is autismfamilyservicesnj.org. You can also reach us through the Family Resource Network or the Family Support Center of New Jersey. We're all affiliated, and our websites all link up together. I thank you guys for taking the time out to listen with us tonight, and hope that we've answered some of your questions. You can reach out to any of us at any time and we will try to help out. Thanks so much. Have a great night.